Namaste, I am Dr. Payal Khandelwal, founder of Ayurveda First. We are located in Siddhapura, Whitefield, Bangalore. I have been treating chronic and critical illnesses through Ayurveda protocols for last 17 years. Asthma is a condition where the airways in the lungs they become inflamed and can cause cough, shortness of breath and tightness in the chest, difficulty in breathing and wheezing sounds. So it is more commonly seen in children due to two important reasons. One is the external causes and one is the internal causes. So what is external causes? That is exposure to dust, smoke, pollutants. Second is frequent respiratory infections, and third is seasonal variation, seasonal changes which can cause flare-ups. The second is internal causes, which is related to weak digestion, chronic constipation. Then apart from that, intake of heavy cold or more dairy products on a daily basis, and third important reason is stress or lack of sleep. In Ayurveda, it is rightly said, Roga Sarve Mandagni, that is from Mandagni or a inflamed gut begins all diseases. So when we treat asthma, we have to consider both external and internal causes and give a holistic approach to treat asthma. In this, most important thing is preventing the intrinsic factors by improving the gut. That is clearing of the channels, giving them Agni Deepana chikitsa, that is improve the digestion, metabolism and prevent the ama, that is toxins which can obstruct the airways. In Ayurveda it is mostly Kapha or Vata which can cause obstructions in the airways and cause asthma. So the treatment is given to clear the toxins, improve the gut and improve the immunity of the child. And the focus is on three important things: is to prevent the recurrence or the frequent attacks and to keep a space between the attacks so that the child doesn't suffer due to seasonal variations again and again. And the third important thing is to improve the immunity and strengthen the lungs and the respiratory system. So whatever protocols we design, for example Panchakarma like Vamana is given in older children, and according to need basis Basti or Nasya is advised, and we also give tips according to the condition. For example, using ajwain water at bedtime, drinking little ajwain water at bedtime helps to clear the airways. Second is doing ajwain potli massages by application. First apply karpuradi oil, warm karpuradi oil on the chest and the back. In seasons like rainy season or where it gets cloudy or where it gets cold, you can do it on a regular basis and then do ajwain potli massages. Then definitely go for lighter meals when the child is having acute symptoms. So lighter meals is like warm khichdi, warm dalia, warm soups like vegetable soups. Specifically avoid sour food like tomato, tamarind, pickles or curd and bananas and heavy dairy products during acute phases, and this has to be taken care on a general level if your child is suffering from chronic asthma. Apart from this, proper exercises and exposure to morning sunlight, at least 20 minutes of good exposure to morning sunlight helps in preventing more flare-ups and more attacks and can help and improve your child's immunity and the respiratory issues. So overall, in a nutshell, if I have to describe, it's not just treating the flare-ups or the wheezing issues, but actually working from the gut, treating the cause of the disease and then preventing attacks is what we define as a complete care of asthma in children, and then giving Rasayana medicines on a daily basis like Agastya Haritaki Rasayana or Chavanprash, which can help and strengthen their immunity once they have been treated for asthma.